Hey, if you're a part of the SRS Retiree Association and you're an SRS retiree in the Facebook group, this video is for you because I'm not trying to sell you any type of Medicare Advantage plan or any type of plan that you don't want. I'm trying to offer you the best information possible for you to decide what is best used for your SRS health reimbursement account stipend. And I've been helping folks since 2017 choose Medicare insurance options in the marketplace because it actually has given them more spending of their reimbursement stipend. So obviously you're going through WriteUp or ViaBenefits, which is a healthcare exchange and platform for you, the beneficiary. And so you guys have a great website that I've been tracking for a long time here on how to get some help, as well as have a community of retirees to make sure that you guys are saving your hard-earned retirement dollars. As you can clearly see, you guys are trying to save on your outpatient drug coverage for your prescription drugs on your Part D drug plans, as well as your Medicare Advantage plans that have Part D drug coverage in it. Now, I understand, WageWorks is a part of this when you're getting your medical claims processed, as well as your prescription drugs out of pockets as well. So, but I have a number of beneficiaries that have decided to go with traditional Medicare and a Medicare supplement because they found that path to be more beneficial to them when using their SRS health reimbursement account stipend for their medical services. And they still are able to get their claims paid and use that stipend effectively for traditional Medicare. Now, I know a number of you are on Medicare Advantage plans, and that has some restrictive networks in it of doctors and hospitals, as well as prior authorization. So if you're listening in on this important message, then this is the time for you to shop your Part D drug coverage and to analyze if you're still on the best path for yourself on these Medicare Advantage plans with a lot more back-end spending. And so this could be beneficial to you, so that way you don't have some max out-of-pocket surprises of $7,600 or even $10,000 plus if you step outside of the network. So let's get to it here. So what I want to make sure of is that you, the SRS retirees out there, know exactly where you stand when it comes to your retirement benefits. Yes, you can shop the marketplace, and the reason why I know that is because of the videos that I've done in the past on my old channel, and I'm going to show you that to you right now, that I no longer list, but I'm going to show you on my original channel what I have here for you. Just a second here, bring that up. And so my new channel is still called Michael C. Fischbach, but you can clearly see that when I go SRS, I have the original document sent to me by an SRS retiree that shows, I posted in 2018, that shows you the Medicare beneficiary, the retiree from SRS, the actual stipend. Let me make sure I can play this. Alright, here we go. And so if you look here, this is an SRS retiree newsletter from 2018, and it shows the starting benefit for the stipends was increased. And I'm going to show you real quick the other one as well from and I no longer have these up, but I might transfer them over to my new channel, SRS again, under Michael C. Fischbach, Medicare Savings, and I try to help you with the actual stipend. Alright, here's the stipend letter, and let's see if it'll play it. Yep, here it is. And this is from My Medicare Advocate SRR, and then this was literally back in 2015, so I helped somebody back in the day from their it used to be called the Retiree Reimbursement Account, or now called the Health Reimbursement Account, HRA, back in 2017, but they showed me the letter from 2015, and this letter specifically states, and I might post this, that Dear Savannah Riverside retiree and spouse, changes are being made to a reimbursement account, and so you can actually shop for Medicare Supplement plans, Medigap plans, as long as you still have your Part D drug coverage with SRS. You are able to shop for lower rates. That's correct, lower Medicare Supplement rates, with an independent brokerage like Medicare Savings out of Charleston, South Carolina. And it says that right here on this letter. And if you're newly retired, you want to stick with the write-up or WageWorks in the first year, because you want to keep your stipend. After the first year, you are allowed to shop the marketplace for Medigap or Medicare Supplement plans. So that's for you to note, and I'll show you the SRS retiree letter if you need to, but obviously you can call the actual SRS retiree organization to see if you can get that letter in your hands yourself. So just note that SRS retirees can shop the marketplace. You can look into coverage that better helps you with back-end spending, and that is straight from a SRS retiree that I've helped for a number of years now, and they are satisfied and stayed on their Medicare supplement plans. So if you have any questions about Part D drug plans for 2022 coming up, they do have some great kind of tutorials on srsretirees.org, but you want to go to medicare.gov and analyze it yourself if you're a smart Medicare consumer, and you can easily put in your drugs and medications on yourself when you log into medicare.gov, since medicare.gov is the administrator for all Part D drug plans in the United States, and as well as Medicare Advantage plans with Part D drug coverage in it. And so you want to know where your retirement dollars are going, and you want to know where your stipend dollars are going. So you just put in your medications, and it will load it up for you, like amlodipine. Yep. And say you're just taking a couple medications, and this is exactly what it looks like. You add another medication. So if you're taking a high tier medication, that's where you want to call not only your WageWorks or ViaBenefits, or ViaBenefits, whoever the exchange, healthcare exchanges for your particular retiree group. But you want to shop the marketplace, and this is how to do it online, step by step, with your mymedicare.gov account. And you just look into the pharmacy that's in your area, and then after you do that, you want to make sure that you get to the network of pharmacies that could be showing you better pricing. So as you can see, this one is higher because I put in a tier 3 medication, and you want to know what medications are covered. If they're out of network, they're not covered. $37,000, Walgreens $7,000. And I'm not here to scare you, but just note that you have to do some due diligence, and don't just trust my word for it in terms of knowing what the best out-of-pocket, what's going to help you from out-of-pocket risk for your Medicare situation. So if you want a free analyzation, you can easily do that and go to medicaresavings.us here in Charleston, South Carolina, and just go to the contact form, and we'll be happy to make sure that your information is safe and sound, because we don't have a call center, we don't call out. We do text you to confirm that it is us, and that it's confirmed that it is you over the phone, so that way it's hassle free. And we have a few help questions for us to help you, or you can wait for your appointment to answer some of those questions to see if we can help you on your Medicare journey. All right, take care, guys. If you're from SRS Retiree Group, thanks so much for watching. If you have any specific or general Medicare questions, you can obviously ask them in the group, but you can contact us right away as a free service to all retirees out there in the Medicare world. Thanks so much. Take care and God bless.